Hi, I'm Sherry Harlan, and welcome to Reid Beside You. Today, our guest is Chris Knight, Vice President and CFO of Reid Health. Welcome, Mr. Knight.
Thank you, Miss Harlan.
We're happy to have you.
Thank you so much. Glad to be here.
And today you're here to discuss a big event that we have coming up in November. It's our all insurance sign-up event.
Yeah, we're very excited at Reid to offer this sign up. Insurance is very important, especially for people that are uninsured or don't know where to go for their health care. So we like to promote this program. We staff it with our claim aid, which is our Medicaid eligibility staff that will come and screen people for the different coverages. And so we're excited, with the open enrollment. Again, this year we're offering the ACA program through CareSource. And so you'll be able to sign up there for that program. You'll also we'll have some other insurance people there that you can talk to. We'll offer refreshments, and we have some giveaway prizes, but no one should miss this event. If you don't have coverage today or you're unsure about your coverage, please come. We provide a lot of information. Also, every other day that we're open, we also have services at our 600 building, which is downtown across from the former Elder Beerman location. And so you can go in there and meet with one of our financial counselors, and they can also, we have the claim aid folks there to screen you. And then if you don't qualify for some assistance there, we also have our financial assistance program that we offer at Reid. So we encourage people to also stop in if they have any questions in the 600 building, and definitely come to our event in
November.
November 13th.
Now, the difference this year that we have traditionally held an event in November that corresponded with open enrollment for ACA, as well as now Medicare Advantage plan. Yeah. So this year at this event on the 13th of November, we will have the Medicare Advantage people there. Yeah. Our Reid Health Alliance Medicare Advantage plan that is accepted at Reid, and that and the sign up for that is from October 15th through December 7th. We also will have the SHIP counselors for the senior health insurance program, so they can guide you as well. And then we'll have the claim aid people there for the HIP sign up. And this year, the state of Indiana has moved most of the redetermination times that will coincide with Medicare Advantage, ACA, and HIP re-enrollment. So that's why we're going to make this a really big event, and we're excited.
And I think with anybody with any insurance question should come to the event.
Correct.
It's sometimes it's very confusing about what's my coverage, what should I do. If you're Medicare and you don't have a Medicare supplement, please come to this. With our partnership with Health Alliance for the Medicare Advantage, it has a lot of things that will be very beneficial for the Medicare population. It covers all of our doctors at all 44 locations. It also covers labs and radiology in those offices. So please come to that event. But if you have any insurance questions or anything, this is the place to come. But we also have services at the 600 building. So if you happen to not be able to make this event, any day you can come to the 600 building. Both Health Alliance is in the 600 building, also our financial counselors, and also claim aid. So we like to be accessible.
And another plus for the November 13th event, we plan to have every one of the Medicaid providers plan to be in attendance. So whether you have Anthem, CareSource, MHS, or MDYs, each one of their representatives will be there. That if you had just questions specific to their plans.
Yeah, and it's going to be in Lingle Hall. So there'll be plenty of room. There'll also be plenty of refreshments. And so we'll have plenty of people to answer your questions. So if you have any insurance questions whatsoever, please come to the event.
And once again on the dates, I just want to share with the public for marketplace plans, the sign-ups are different. The actual sign-up dates start November 1st, and that deadline that you would have insurance in 2019 is December 15th. The Medicare Advantage starts October 15th through December 7th. And the HIP, we were trying to basically from November through December, but it's ongoing. And we want to make sure that anyone that had any type of questions.
Yeah. As Sherry elaborated, this insurance stuff can be quite confusing. And so for this reason, we like to have this open enrollment event that allows you to access all of these carriers, all these different programs, whether it be Medicaid or Medicare Advantage or don't fit within those two programs. We also have the ACA program with CareSource. So it's a very good event, but please plan to come.
One of the biggest things that questions I receive when I'm out in the community on how do we determine with insurance plans, and could you elaborate?
Yeah, we try to have contracts with all insurance plans, all the commercial plans. We have a program where we accept all those insurances, but we're kind of limited here in Wayne County. For the ACA, there is only actually one plan that's offered in our county, and we're contracted through the RHPA side of the organization. That you can get services there. You can also get emergency room services at the hospital. You can get your lab and radiology services covered in any of the RHPA offices. So this is the only plan that's actually offered here. But we do accept all the expanded Medicaid programs, as Sherry elaborated, with Anthem and MDWise, MHS, and CareSource. So we accept all the Medicaid plans that are offered in Wayne County. And we accept the only ACA plan that's accepted in Wayne County, which is CareSource.
Right. And on that same note, I'd just like to clarify, it's not a matter of Reid not accepting, it's a matter of what insurance companies are covering our service area. And some companies have chosen not to extend to East Central Indiana, which can be a challenge for our area.
Yeah. Last year, when it looked like we wouldn't have any plans offered in Wayne County, we got together with CareSource and through the state and made sure that we had a plan that would be offered here in Wayne County.
And that's exciting.
Yeah.
And that really helps for people that have like chronic diseases, so that they have the opportunity to still continue with their chosen physician that's a member of RHPA.
Yes.
So that gets people to have continuous service.
Yeah. We have a wide spectrum of specialists within RHPA. We have oncologists, cardiologists, orthopedic doctors, and nephrologists, and we just have the full gamut of specialties here at Reid.
And it's with 45 offices?
45 offices in 7 counties, 2 in Indiana, 2 in Ohio, and 5 in Indiana.
Correct.
So we're try to be in all those communities.
The challenge, and then CareSource, they plan to have a large presence, because not only do they have our ACA plan, but they also have a plan that covers for Medicaid.
Correct.
So they plan to have a big presence on the 13th.
So, yeah, all of these insurance carriers will be there on the 13th, so it'll be a chance for you to talk directly to them, and it's very exciting to gather more information. So if any questions, don't hesitate to come.
And if nothing else, they can come and have great snacks and drinks, and I'm sure some of the Medicaid providers, as well as the other insurance providers, will also have giveaways as well, along with. One of the nice surprises that we're going to have a giveaway is a 50-inch flat screen TV. So last year we had some people that received new access to health care and walked away with a flat screen television. So I think one person said they were going to use it as a Christmas gift. So not only did they receive their insurance, but they also had something new for their family.
Yeah.
And so, Chris, was there anything else we wanted to share with the audience as we close?
As we close, I just want to say Reid is there right beside you, and we're excited to offer these insurance programs for services within Reid and want to really answer your questions. So come on the 13th or any other day if you need to come down to the 600 building downtown.
And thank you very much, Chris, for joining us
Appreciate it,
today.
Sherry.
And we hope to see you on the 13th.
Thanks so much.
Thank
Have a great
you.
day.
Hi, what seems to be bothering you?
Hey, Doc, I got a fever and chills. I really don't think I should be on the road.
Okay, I think that's something we can help you with.
Real-time care anywhere. Reid Health Now, right beside you.
Hi, how can I help you?
My daughter has a fever and she isn't feeling well.
Okay, let's get her feeling better.
Receive quality care within the comfort of your own home. Reid Health Now, right beside you.
Hi, I'm Sherry Harlan with Reid Beside You, and we want to welcome you back. And our next guest is Dr. Dr. Abraham from Reid Oncology, and you are new to our staff.
Yes, I am.
And we want to welcome you,
Thank you.
to our area. And what brought you to Reid?
Thanks for having me, Sherry. Reid was a very appealing opportunity for me. I think the Reid Hospital offers a unique opportunity in that it's big enough where you can offer cutting-edge treatment. Oncology being a rapidly changing field, it is critical that you work at a place that offers absolutely cutting-edge treatment. So I have the ability to offer cutting-edge treatment, but it's small enough where it's a more intimate setting. You get to know your patients well, and it's not just me and the patients. It's a small enough environment where my staff gets to know the patients well. If a patient goes to have a CAT scan, the staff there knows the patients well too. So it's a perfect marriage, I feel like, between an institution where you can offer cutting-edge treatment, but where it's small enough that it's a friendly working environment and an opportunity to really make a difference in the lives of people and in a community.
Oh, great. And on a personal note, we have admired your savvy bow ties as that you're wearing today and most days. And I understand that your wife makes your bow ties.
So as with all things, my wife is my better half. Yes, she does. My wife was actually born and brought up in Winchester, so not too far away from here. So that was another
selling point, I'm sure.
Another selling point. I mean, she's not too far. This is pretty much home for her family. But yes, she's a physician, but unlike me, she's multi-talented, and she actually I used to wear regular neckties, and she likes bow ties, and that's when she started making bow ties for me. So yes, she makes the bow ties and the matching pocket squares that go with it. So incredibly lucky for many things in life, but including being married to a remarkably talented woman.
That's amazing. Well, your bow ties have preceded you, and so that's a really recognizable feature.
Thank you.
And so I just wanted to let the audience know that.
Yeah, I'm always happy to take credit, even though when I don't deserve any. In this case, is my wife's creation.
And in your study of oncology, with the upcoming, with October being Breast Cancer Month, so something would you like to share regarding just breast cancer specific?
Certainly. Breast cancer, October is obviously Breast Cancer Awareness Month. The key thing that I would mention is there are tremendous advances being made in the treatment of cancer. But even with all the advances, early detection remains the key for the highest chance of cure and the best outcome. So for breast cancer specifically, mammograms are important. in detecting cancer early and having a good outcome. So just really briefly, it is recommended that every woman over the age of 50 undergo an annual screening mammogram. Certain people with a higher risk, say a family member who's had breast cancer, you can start screening at age 40. Otherwise, for the average person, age 50 and above, you should get an annual screening mammogram. You have an outstanding network of primary care providers here, so get in touch with your primary care provider to get you set up for a mammogram. I think that still remains the key to having the best chance of cure if someone were to be diagnosed with breast cancer.
And I would be remiss if I didn't give a highlight of the Reid Breast Cancer Center. That when you come in for the mammograms, they make you so comfortable, and they have you at peace, or because it's always usually a little nerve-wracking. I know it breast cancer runs in my family, so I'm always a little nervous each year. And because I have a higher risk factor, I have to go every year. But our breast center, have a great staff, as well as those wonderful warm pink robes. So most of the people that are coming in for the mammograms, that's the first thing they usually compliment, that the nice robes, and they just feel comfortable when they're there.
I think that's a unique aspect of the hospital. Like I was saying, it's a small, enough friendly, enough atmosphere that it can make it as less intimidating as it possibly can be.
Right. Then, when they come in, what can a patient expect on their first visit when they come in to visit you?
So,
if they've been referred.
Yeah. So, the key thing that I would try to emphasize is that I try to give a patient as much information as possible regarding their diagnosis and treatment options. I would like to make any treatment decision a joint decision. I always view my primary role as being giving as much information as possible, and enabling the patient to be an active and actually the driver of decision making, armed with the accurate information. So I would hope to provide a lot of information, and as well as compassionate and cutting edge care.
And on part of that compassion, I know when my mother was diagnosed, I'm glad I went with her. So a lot of that, you should always have a caregiver, because when we discussed later, she had no clue. She said after they were saying what stage she was, I think she just checked out.
I think that's a very common experience, Sherry. I think it's a lot of information to take in at one time. So even the sharpest of us, that's
Right.
a lot of information to take in. So it's always helpful, like you said, to have a family member or someone, a supportive member of your family or extended friends be there with you.
Right, because when we were going back through the notes, she said, I don't remember
Yeah.
any of that.
That's a very
So
common.
I would always
experience.
recommend to take someone with
Yeah.
you, just so that they actually heard everything
Right.
that they should. Also, so how do they? I know there's new cutting edge treatments.
So this is a dramatically changing time in medical oncology. Actually, I would say no field in medicine has changed as much over the past few years as oncology has. So I'm just making this number up, but 90%. So I graduated medical school from University of Maryland in 2004. So not that long ago. I would say about 90% of the medications I use in actual practice today, I did not learn about in medical school. They all came after.
Wow.
So these improvements in the treatment of advanced cancers have been largely driven by two things. One is something called immunotherapy, which is using your immune system to fight the cancer. And this is a dramatic game changer, because there are now previously cancers that were considered incurable with a poor prognosis, where not in everyone, but there are cases where the prognosis would have been extremely bleak, where people can have a very extended survival now, and even in some cases, cancers which were considered incurable can be cured now. It's actually a quantum leap forwards.
Were there any
And-
specific types of cancer?
Yeah,
that-
so the example I always bring up as a poster child for successful immunotherapy is melanoma, which had spread. And the classic example of this is former President Jimmy Carter, who, as some in the audience may know, had a melanoma which had spread to the brain and the liver. Now, when I was in medical school, if you had that diagnosis, the prognosis that had been given to that person would be 6 to 12 months, probably closer to 6 than 12 months. But President Carter got immunotherapy, and he has no evidence of cancer today. It's all gone. So today, whereas when I was in medical school, the average survival of stage 4 melanoma, which is melanoma that had spread, is around 6 to 12 months. Today, the numbers are, so this is stage 4 melanoma where it has spread extensively. The numbers are about 40% of people are disease-free in 10 years. So you started out with melanoma that had spread, you get immunotherapy, and 10 years out, you're still going strong. So if you put that in a historical context, that's a long ways to come in a decade. And it's happening in other cancers like lung cancer as well. So immunotherapy will likely have a historic significance when cancer treatments are spoken about, and we are just in the cusp, is scratching the surface of immunotherapy. Because these drugs, for example, for melanoma got approved like in 2014, 15, something like that. So there will be further improvements made in it.
And another, what about the genomics?
Yeah.
Genomics.
So as I was mentioning, these improvements in the treatment of advanced cancers have largely come about because of two things. One is this, what can only be described as a revolution in immunotherapy. The second thing is what they call genomics, which is trying to identify genes which are abnormal in cancers and are driving the growth of cancers. So if you can identify something that's driving the growth of your cancer, it is much easier to target it. If you have one thing in particular that's driving the growth of the cancer, for example, if you have a car that's speeding out of control, and you happen to know that your foot is permanently stuck on the gas pedal, the fix is to remove the foot from the gas pedal.
Right.
It's one problem, it's your foot on the gas pedal, you treat that. So if you know what gene in particular is driving your cancer, it's easier to target that with medications. So genomics is trying to identify genes that are driving the growth of cancer and target that with medications. So here we'll be starting, we have started what's called genomics, which is when a patient with an advanced cancer is diagnosed, we do what they call sequencing, which is trying to identify genes that are abnormal. Those results are complex, but we have arranged for these cases to be discussed at a conference where, in addition to physicians, there are geneticists and molecular biologists who would help interpret that data, and you would tailor treatment to the unique characteristics of each individual patient.
And we are using that.
Correct.
We're currently using
Correct.
that at Reid.
That is correct. Yeah.
Right.
Yeah.
Now, how is that determined? Who uses that procedure?
So,
are they referred, or you decide?
Yeah. So usually, like, this thing called genomics sequencing is now standard enough that it's a rapidly evolving area, but it is now standard enough that Medicare covers the testing for it. So basically, like any patient with advanced cancer, advanced meaning has spread, is eligible for genomic testing. So usually it's an oncologist that starts the process of getting the biopsy, what they call sequenced, which is trying to identify genes that are abnormal. So the answer to your question would start with us.
Okay. And as the patient and I know that we also have our navigators.
Yes.
So the navigators would actually help with the patient as well as with the caregivers to explain that, because not the average person would understand.
No, so a couple things. One, it is the navigators are, I believe, a tremendous resource for this program. All three navigators, Brenda, Diane, and Jill, are absolutely phenomenal.
They're all great.
I've practiced in other hospitals in Indiana for over the last 10 years, and I feel like one of the uniqueness of this cancer center is those three navigators, and the rest of the staff is simply outstanding as well. As an aside, I think this is the most supportive, qualified staff that I've ever had the opportunity to work with. So they are a tremendous resource. But just specifically regarding the genomics, before any genomic testing is done, I would talk to the patient at length to explain it to them as to what they may gain or hope to gain from it, and then obviously the navigators and the nurses would obviously be there as a subsequent resource. But I would talk to them extensively about it before they actually have the testing.
So how will patients get in contact with you, or if they need to make an appointment?
So for us, usually the referral is made through their primary care doctor, but I'm happy to see anybody who wants to be seen, so they can contact our cancer center, and I'll be happy to see anybody who would like to be seen.
And we have information on how to contact you, as well as the oncology office. And we want to thank you,
Thank
Dr.
you.
Ibrahim,
Thanks for having me.
joining us, and welcome to the community
Thank
again.
you. Thanks for having me.
And thank you for watching this episode of Reid Beside You.